This is anatomy and surgical approaches to the leg and ankle. First, we'll start with the cutaneous innervation of the leg. On the medial side of the tibia lies the saphenous nerve, innervating the skin on the medial side of the leg and foot. On the lateral side, proximally, we have the lateral cerulocutaneous nerve, and distal to that, coming out around extensor digitorum longus of the foot, lies the superficial peroneal nerve. This is coursing distally and curving around the ankle joint itself. This terminates in two branches innervating the dorsum of the foot. One is the medial dorsal cutaneous nerve, and the other is the intermediate dorsal cutaneous nerve. Posteriorly in the leg, the skin sensation is supplied by the sural nerve, coursing down the mid-aspect, the posterior aspect of the leg, and coursing around posteriorly to the lateral malleolus. Next, we'll move on to the compartments and muscles of the leg. The first one being tibialis anterior. The origin is from the lateral proximal tibia and the tibial condyle, as well as the interosseous membrane and the superficial crural fascia. This courses distally to insert on the medial surface of the medial cuneiform and the first metatarsal. Its action is to dorsiflex the foot, as well as inversion at the subtalar joint. The nerve supply is from the deep fibular nerve, and its arterial supply is the anterior tibial artery. The next muscle of the anterior compartment of the leg, extensor digitorum longus of the foot. This muscle has an insertion in the head and anterior margin of the fibula, as well as the lateral condyle of the tibia. Its insertion runs distally to the bases and dorsal aponeuroses of the lateral four digits to the extensor expansion. Its action is a weak dorsiflexor of the foot, as well as extension of the metatarsophalangeal and interphalangeal joints of each related digit. The third muscle of the anterior compartment of the leg is the extensor hallucis longus. This muscle has its origin from the medial surface of the fibula and interosseous membrane, courses distally to insert on the base of the first digital phalanx and dorsal aponeurosis of the first digit. Its action is a weak dorsiflexor of the ankle again, and to dorsiflex the first ray. Its nerve supply is from the deep fibular nerve. The fourth muscle of the anterior compartment of the leg is the fibularis tertius. This muscle arises from the anterior surface of the distal fibula to insert on the dorsal shaft of the fifth metatarsal. The lateral compartment of the leg, we see fibularis longus here. And again, this runs posterior to the fibula. Here we see fibularis brevis running actually anterior to fibularis longus, or peroneus longus. Peroneus longus has its origin from lateral surface of the proximal tibia, and its insertion on the lower surface of the medial cuneiform and base of the first metatarsal bone. This is innervated by the superficial fibular nerve and has its arterial supply from the fibular artery. This is peroneus brevis. This muscle has its origin on the lateral surface of the distal fibula and the intramuscular septum. Courses distally behind the ankle joint in front of the peroneus longus to insert in the base of the fifth metatarsal. Its action is to plantar flex the ankle as well as evert the subtalar joint. There are two muscular compartments posteriorly, the superficial and deep posterior compartments. The first and largest compartment of the posterior aspect of the leg is the superficial posterior compartment. This starts off with the medial and lateral heads of the gastrocnemius. They have their origin from the posterior aspect of the femur and the medial femoral condyle, as well as lateral femoral condyle. they insert on the dorsum of the calcaneus via the calcaneal tendon. This causes a strong plantar flexion force at the ankle joint and is innervated by the tibial nerve, S1 and S2, and its arterial supplies the sural artery and posterior tibial artery. Deep to the gastrocs lies the plantaris and soleus. Plantaris is seen here. Its origin is from the posterior aspect of the lateral femoral condyle and courses distally, having a curved course and inserting onto the dorsum of the calcaneus medial to the calcaneal tendon. This causes flexion of the knee as well as plantar flexion at the foot and is innervated by the tibial nerve as well. Underlying plantaris is soleus, or soleus. This lies and has its origin on the posterior surface of the proximal fibula as well as the soleal line of the tibia. Courses distally and inserts via the dorsum of the calcaneus via the calcaneal tendon, causing a plantar flexion force at the ankle joint. Now to hide this, as well as hide the Achilles tendon seen here, lies the deep posterior compartment of the leg. The most lateral muscles in the deep posterior compartment of the leg is the flexor hallucis longus. This has its origin in the interosseous membrane as well as the distal 2/3 of the posterior surface of the fibula and courses around the medial side of the ankle to insert in the base of the distal phalanx of the first toe seen here. Its action is to plantar flex the ankle joint as well as invert the ankle and plantar flexion of the metatarsal phalangeal and interphalangeal joints. The next most medial muscle is the tibialis posterior. This has its origin also on the interosseous membrane and adjacent margins of the tibia as well as fibula. Courses distally, again in front of the flexor hallucis longus, to cause a plantar flexion of the talocrural joint. Its insertion is somewhat of a broad insertion with a navicular tuberosity as well as the medial cuneiform and the bases of the second through fourth metatarsals. Third muscle of the deep posterior compartment is the flexor digitorum longus of the foot. This has its origin along the middle third of the posterior surface of the tibia, courses distally to insert into the bases of the distal phalanges of the second to fifth digits. This causes a plantar flexion of the ankle as well as inversion of the subtalar joint and plantar flexion of the metatarsal and interphalangeal joints of the second through fifth digits seen here. Now if we were to examine the posterior vascular anatomy of the knee, here we see the popliteal artery branching first into the anterior tibial artery, traversing the interosseous membrane to run down the anterior aspect of the interosseous membrane. We also see the fibular artery and branch to the posterior tibial artery. These both course distally in the leg. Here we see the specific anatomy of the fibular artery arising from the posterior tibial artery. Branches of this artery go to nutrient vessels to the fibula, as well as the lateral malleolus, and perforating arteries to the muscles and fascia of the lateral leg. The posterior tibial artery arises from the popliteal artery. This artery supplies the posterior and lateral leg as well as the plantar aspect of the foot. Here we see the anterior tibial artery. This arises from the popliteal artery through the interosseous membrane, coursing distally along the interosseous membrane. This terminates in the dorsalis pedis artery and supplies the anterior leg and dorsum of the foot.